I think we'll kick off. Welcome everyone. Hello, I'm Linda Govan. I'm the Senior Manager at the WVPHN Ballarat office, and I'd like to welcome you to today's session on Through COVID-19 and Beyond, the second in the four-part series aimed at supporting you through these very challenging times. I'll start with some housekeeping. In about 15 to 20 minutes, you will be sent automatically into breakout rooms. So we ask that when you do get into those rooms, you switch your cameras on so you get a good sense of who you'll be chatting with at that time. Firstly, I'd like to start this session by acknowledging the traditional owners of the land on which we are meeting today. I would also like to pay my respects to elders, past, present and emerging, and welcome any Aboriginal people with us today. I'm speaking to you from Wathaurong country here in Ballarat. In our virtual room today, we have quite a few of the PHN team. We've got members of the practice facilitation team, senior managers joining us, Claire Dagley and Claire McDonald and myself, members from our workforce development team, and Dr. Kate Graham from our health pathways team. And we should have, by the end of the session, up to 60 practice nurses and practice managers joining us today. So that's a really great, it's going to be a really good session. As you know, this has been a really challenging year, and as we move slowly towards a COVID normal world, the PHN will continue to support you and your teams. So whether that's PPE distribution, education sessions like these, or the weekly echo sessions we have every Thursday morning, the community of practice established to support general practitioners, or cross collaboration across the acute, aged care and primary care settings, we continue to advocate to both the state and Commonwealth governments on issues that impact on primary care. Most recently, the PHN has been working hard to get the Head to Help mental health hubs established. We've got two in our region, one in Nor Lane in Geelong and one in Sebastopol here in Ballarat. These are funded by the Commonwealth and they've been established to support anyone whose mental health has been impacted by the pandemic. There's more information on these on our website if you need to follow up on that. And in continuing, and Rivka, I'll get you to throw to the next slide there. Great. So in continuing to support general practice, we are also really pleased to announce that we have partnered with the Benchmark Group and are able to sponsor 30 practice nurses to undertake the first unit, Foundations of Immunisation Practice, as part of the nationally recognised course in immunisation practice. Applications are now open. They close on the 30th of October. Katrina's popped some information there in the chat for you. And please reach out to the workforce development team if you'd like any more information. We will be emailing these slides out to you. And so there's a link in the slide that you can find more information out as well. Now I'd like to hand over to Dr. Kate Graham from our Health Pathways team. Thanks, Kate.
Hi, everyone. So I just wanted to remind everyone how Health Pathways can help you all navigate the difficult environment that we find ourselves all in. So we do have an expanded range of pathways that hopefully you all have found your way towards. And there are definitely ones that are relevant for practice nurses and practice managers out there. So in particular, the COVID-19 information, the practice management and practice support ones are really useful, but as well the referral pathways are kept really up to date with information about when the testing sites are open, closed, hours, criteria, because as we know, they change day to day depending on what's happening around our regions. We've also got lots of information on our mental health support pages, and we've got the MBS items, electronic prescribing, all new things that have come up as a result of the pandemic. So I'd really encourage you to sort of log on if you haven't before. We've got the passwords there. If you've got any feedback about any of them, you can click on the feedback link on any of the pages and that comes through to us. And we'd love any feedback about anything else that you'd like to see on our pathways, because they're really sort of live pathways in that we can adjust anything that you need. So we'd love to hear from you. So thank you, and I'll hand back to Linda.
Thanks, Kate. Excellent work. The health pathways are really, really good. Finally, from me, don't forget you have the opportunity to access 4 free online learning modules with more support from Rivka and Kim. just contact your practice facilitator, or Sharon L's details are there as well. But a really great opportunity to continue learning around everything that you may be hearing about today as well. Now, for those of you, I'll just introduce Rivka and Kim for those of you who may not know too much about them, but I'm sure that's probably not the case. But I'll start with Rivka. Rivka has an extensive background in medical practice management, RACGP accreditation, business planning and general practice business viability. Rivka continues consulting or provides consulting, advisory, coaching and training sessions to healthcare organisations and PHNs nationally. And you may also know Rivka is the founder and administrator of the global Facebook group Practice Managers Network. It's a really great forum to get onto if you're not using it already. And Kim Poyner has an extensive history working with general practice and primary health networks to train medical professionals in behaviour change theory and chronic disease management. Kim currently provides training to health professionals across Australia in quality improvement strategies, amongst other topics, and regularly presents at national conferences as a keynote speaker on change management, teamwork, coaching, chronic disease management, creating efficiency in general practice and care coordination. Kim is faculty for Well Coaches Australia and has her executive coaching endorsements through ICF. And Kim is also a director of the Australasian Society of Lifestyle Medicine and the Practice Excellence Institute. So welcome to you both, and I'll hand over to you, Rivka. Thank you.
Oh, thanks very much for that, Linda. It's lovely to be with you all again on yet another week of Corona challenges within our practices. So today's workshop, today's session is going to be a little bit different to the last one, and hence we've sort of introduced this as a Zoom meeting rather than a webinar, so that we can get you guys together and a bit more involved in chattering to each other and doing some brainstorming along the way too. So we'll give you a little bit more detail about that in a moment. But through your registrations, what came through was that you're very keen to hear a little bit more about the most recent MBS changes and updates from the 1st of October. So before we kick off into breakout rooms, I just want to give you a quick run through those changes. So in terms of Medicare and anything to do with changes there, you really need to keep your eye on the mbsonline.gov.au website, and they break their news into the months when changes occur there, and you can click on the link that's up on the slide there. This is where all of this information comes from. So it's a really good resource to keep you up to date, because things are just changing so very rapidly at the moment. It's important that you know where to find all of this information. So from the 1st of October, what's been brought out is another $2 billion of funding for extending health services. So that's a huge whack of money. And the most important component of that is the extension of those temporary telehealth and telephone consultation item numbers, which are now going to be guaranteed until the 31st of March 2021. And remember, that was originally going to be finishing up at the end of September, so that's been carried through. Another really important change that's just come through is the removal of the requirement to bulk bill the telehealth attendances for vulnerable patients. So that was a real sticking point for many practices, and it's important that you're aware that you no longer are beholden to that absolute requirement for bulk billing, which is a very welcome change. Now, in terms of telehealth services, it is still the case where those services have to be performed by the patient's usual medical provider. And by usual, that means that they need to have attended the practice within the last 12 months, with the exception being of the lockdown area. So that's more so Melbourne metropolitan area rather than the West Vic region. So just to be aware of that. Another important change, and this one is not quite so positive, is that temporary doubling of the bulk billing incentive items. So it's both your 10990s and 10991s, and also the telehealth bulk billing incentive items. They had been doubled, so the amount that you were going to get paid had been double the usual amount up until the end of September. And that doubling has now stopped. So those amounts are now coming back to their normal rebate amounts. So it's half of what you have been getting. This is important because this will be quite a big difference to basically the bottom line of the services that you're providing. If you had been bulk billing and the bulk of your patients are eligible for those incentive item numbers for bulk billing, then that's going to make a big difference. And you need to keep that in mind when you're thinking about your budgeting going forward. Now, there's also a bigger change to the mental health items, and I'll give you a little bit more detail about that in a moment. And essentially that means that practices or patients can now access up to 10 additional treatment services in a calendar year for treatment of mental health disorders. This is through the Better Access planning. So let's just step through what that actually looks like. So this will be valid until the 30th of June 2022. So that's you know, a year and a half's worth of additional mental health item eligibility. So what that means is that patients can receive 10 additional individual psychological therapy sessions per calendar year. This was previously restricted to the lockdown areas, and I know that this has caused a little bit of confusion going forward, but that restriction is now lifted. So it's kind of an across the board, it's actually across Australia that patients are able to access that additional support. Now, at the moment, that psychological support can still be provided through the telephone and telehealth item numbers, and that's guaranteed until the 31st of March next year at this time. So really, we don't know whether that's going to be extended further after March. We really need to see how coronavirus shows itself over the next few months, I guess. Just a quick reminder too that the Better Access Pandemic Support Program remains unchanged. So that was already providing some additional services for patients to 12 of the focused psychological strategy services, 6 for clinical psychologists and 18 for other psychologists, occupational therapists and social workers. But in addition to those, the 10 additional services still play out in that space as well. So in terms of the mental health eligibility, so patients need to be on an approved treatment plan, which could be a mental health care plan developed by GPs. It can be a shared care plan. It can be a plan developed by psychiatrists, or an approved written plan developed by their GP, psychiatrist or paediatrician. So all of those are eligible for those additional 10 service eligibility items. So the patient needs to have used up their 10 individual Better Access sessions before they are looking for a referral for additional sessions. And the way that works is that a referral is required from the referring GP for the services provided by psychologists and OTs and social workers and the like. A referral is not required where it is the GP actually providing those focused psychological strategy sessions. And again, there's been a little bit of confusion about do we use a Medicare mental health care plan review item, the item 2712 or equivalent? And the answer to that is that if a review is due, then that is what the GP should be using. But if a review has taken place within the previous 3 months before the referral to the extra 10 sessions is required, then a standard consultation fee can be used to create that referral pathway. So it doesn't specifically have to be the review item number, but it must be done in accordance with the overall framework of the mental health care plan, Medicare requirements. So there does need to be a review in there of sorts, but if it's been done, then just flip through to a consultation item. And at this stage, I'm going to hand over to Kim. So again, I'd like to just invite you all to also remember the Q&A box to lodge any further questions that you have, and we'll be very happy to run through those at the end of this session. Over to you, Kim.
Hi everyone, and thank you for joining us today. A Monday lunchtime, and no doubt you have all just got through Monday morning, so you've come into lunchtime ready for a bit of a networking session. Hopefully we're going to pop you into some rooms. We're going to put you into 4 rooms. They're going to be randomly allocated, so we cannot get you to choose which topic you'd like to go into. We're going to get you guys in there talking about 4 different topics. The first one being patient flow and triage. The second being COVID safe planning. The third being business planning and opportunities. And we've got self-care strategies. So we'd really like you to go in. You can name or nominate a speaker for your group so that when we come back together, that person presents the information that you have discussed. Have a quick intro. Who's in your room? Who would you like to get to know more? But keep it really short and succinct, because you've only got 15 minutes in totality in that room. And I know we can get busy being excited about the other people that are in there, but just quick name, where you're from, and move on to the topics at hand. As I said, then we'll bring you back into the room. How do you know that's going to happen? On the top of your screen, we will send you a message giving you a countdown to how many more minutes are left for you to be in that room. So you'll see 10 minutes, 5 minutes, and then just like magic, you'll pop back into your breakout. How do you get into a breakout? You'll also see a pop-up that'll say you're being allocated to a room, and you need to accept that to go into your magic breakout room. And then we're going to open up the floor for some Q&A. Rivka and I will be coming virtually into your rooms so we can nudge conversation, hear what sort of information that you guys would like some more deeper dive on in that Q&A as well. So really get to know the people in your room. It's all about being inclusive. It's all about making sure we brainstorm. So loads of ideas without evaluating the ideas is the plan of attack. So Riff, do you want to pop in everyone into their breakout, and let's see how we go with this virtual room.
Yes. All right. No, I think I have to assign everyone individually. So I'm just going through and doing that now. So just be patient, and we'll get you in there as soon.
So why don't I start off the discussion around patient flow and triage? So these 4 topics were nominated or allocated based on when you registered. And what a lot of the conversation, particularly in the registrations, was around how are people doing screening as people are coming through the door? How are they working out video versus telephone consultations or face-to-face? No doubt you've also got hay fever symptoms and asthma symptoms that are clouding a little bit of that COVID planning on face-to-face versus going off and having video or phone consultations. Are you using a software platform or a booking platform to assist you with that? What are you doing? Health assessments yet? Are you doing care plans face-to-face, or are you doing a blended model? Again, are you triaging at the front door? Are you triaging over the phone? Are you using a nurse? Are you using reception? The business planning and opportunities, as Rivka described before, looking again at, are you having to look at the current model moving forward? Are you looking at using health assessments again into your planning? Are you starting to look at using your different COVID response MBS item numbers for mental health? And the self-care strategy should be pretty pretty clear and straightforward. And like magic, everyone's coming back in.
Everyone's coming back through. So there were not enough people to complete the business planning and opportunities group, but the other 3 were going.
Perfect. All right. Have we got everyone back?
Everyone's back.
All right. So in terms of patient flow and triage, group 1, Riff, who did we have in that room?
Oh, well, I don't have a list of names available for you. But
I think we had Barbara and Claire, I think we had in that room. I think we also had a number of others, Kimberly. So who would like to be the spokesperson of that room in terms of all things patient flow and triage?
So turn on your camera and turn on your microphone and then come and join the conversation. Katrina.
Katrina here. I was just going to ask Annie, Annie, would you mind popping yourself on video and being the spokesperson for our room? Just so that you're hearing from a non-PHN person. Or Barbara.
Oh, hang on.
There she is.
Hello.
Thanks, Katrina. I guess, well, we both come from 2 very, very different backgrounds. I guess I'm sort of at a not-for-profit organisation where we don't get to really call the shots. We've got, like, you know, a whole lot of governance systems and that are in place that make those decisions for us. However, with our patient flow and triage, it's up to the doctor's discretion who they've been seeing. Obviously, we book a telehealth appointment, and as I said before, telehealth and phone consults have worked really, really well for us, being a bulk billed clinic. And so I'm at Headspace, so we've got a lot of kids there. And we've just been asking questions. It's up to the doctor's discretion who they see, who comes into the building. With Barbara, she was at a UFS organisation in Ballarat, and they had sort of 2 people on the front door, you know, doing their triage prior to coming into the building, and that didn't really work that well for Barbara, but they've only got 1 person there now. And yeah, that's us. But I guess that it's worked really, really well for us at Headspace. We've got it down pat. The whole organisation has been really, really compliant with all of our clients. So we have a sort of like a social services organisation. So we've got lots and lots of people sort of coming in and out, and it's been amazing sort of to see everybody work together and pull together and, you know, have the patients and the community's best interests at heart. And everybody is so used to just, have you been to Melbourne? Have you been in contact with anybody with, you know, COVID? Do you have any flu-like symptoms, cough, cold, sniffles? It's just normal and flows off your tongue now.
I guess part of the initial discussion, isn't it, in early days, is a lot of people were experiencing people who felt ashamed to own up to the fact that they had symptoms, and it seems to be less likely now. There seems to be less of that discussion, particularly in the Practice Managers Network, RIF as well. People seem to be having those processes, and everyone understands the importance of saying, yes, I have got those symptoms, and you know, moving to that telehealth consult instead is sometimes received really well accepted and gratefully accepted as well.
Look, interesting feedback too. I just want to sort of share a snippet with you as well of a really novel idea that I heard about last week, and I thought, oh, gee, why didn't I think of that? But it's really quite ingenious, and that is a practice who had decided that, especially, you know, with keeping doors closed and locked, and really screening patients before they come into a building, of, you know, the flow around that being really quite problematic. And what they had decided to do was to install a a video intercom system at the front at the front of the building, so that patients could actually speak into this microphone camera, and the reception staff can actually converse with the patient and do that from the front desk area. So I guess it's just that next step of evolution of our systems and processes, now that we kind of understand that it's likely to be there for a longer period of time rather than a shorter period, that we need to come up with some more robust solutions for what just makes life really difficult at the moment, and thinking, well, what are the next steps and what are the next strategies to just take that pressure off. And I thought that was a really neat suggestion.
We've done that. We've got a camera and an intercom at the front of our building. So there's another not-for-profit org in town. We actually moved our whole GP treatment room downstairs. So within 2 days, we'd set up another treatment room downstairs, and it worked really, really well.
Yeah.
So that's what we're doing.
Awesome. Well, thanks, Annie. We might move to the COVID safe planning, and I know Linda Govan was in that room. Linda, did you have a spokesperson for that room?
No, but I'm willing to ask Kim or Tracy or Alistair if they'd like to be a spokesperson for the group. Let's see if any of them pop their hand up.
I'm happy to talk.
Thanks.
So I think one of the things that come out of ours is that trying to work out now, how do we change, because at the moment we've got everybody in cars and ringing when they arrive and doctor triages, but at what point can we start to bring them back into the medical centre, and how will that look? So that's the next step for us in being COVID safe.
All right. Riff, do you have any new ideas there from your discussions within the network group?
Look, I think it's a moving feast, isn't it? It is dependent on just so many factors, and it might look different for different practices as well. I guess in terms of the COVID safe planning, it's also about just the awareness of the sort of the DHHS, the state government COVID safe plan that is now being mandated. So just being really aware that there is a framework there that practices must put some thought into and actually document that. And it runs along the lines of your pandemic planning anyhow. So there isn't anything that is mind-blowingly different to that, but it does provide something just a little bit more robust for giving you the pointers of, well, what's next, and where does our thinking need to go, and what are the systems we need to implement, and what are our next challenges. So I don't think I can give sort of a blanket response as to, you know, when can we open up and have everybody back again. I would say to keep your eye on all of the information coming out from PHN, from DHS, from DHHS, and make your decisions accordingly. And I guess I would say too that, you know, certainly practices do have a responsibility for the safety of their staff as well, and it's really difficult to balance that in this current the current state that we're in. So from the organisation's point of view, from the practice and the practice management point of view, the employer absolutely has a duty of care to make sure that staff remain safe and well. So you need to do what's fair and reasonable to respond to this. So doing nothing is not an option. But you also don't need to go to the extent of, doing everything and thereby, I guess, immobilizing yourself in an overload of systems and processes. You've just got to find that balance, and you need to use the information that's out there to guide your thinking in that space. But I'm keen to hear too from Alistair. Were you in the room there too?
Now you're going to test to make sure I've been concentrating. We all spoke a bit about what we are up to putting together our plans, getting ready for opening up a little bit more. I guess from our point of view here, we're just a small GP clinic within a wider alcohol and other drug counselling service. And we've, like Annie, we've got the camera at the door with the microphone, and so everybody's screened before coming in, and they step inside and they are temperature tested and asked all the questions. But generally, we're all on, well, the majority, I've had a look, we've got 5 appointments today that are in-house, the rest are, and they'll be predominantly by phone. Moving forward, we certainly need to be compliant with the edicts of DHHS, the AOD side of the business as well. So that certainly we've got our COVID safe plan, but we've now got the template version from DHHS sitting alongside that, and ever mindful of ensuring that services are clean and staff are wearing masks, except when they're hiding in an office with the door closed. And yes, so that we minimise any risk should there be any.
Yeah, I think that sounds like reasonable feedback. I guess my question for you is, did you find the DHHS COVID safe plan ostensibly different to what you had already put together in terms of process? Was there anything surprising that came out of that?
No, not really. The exercise is mainly a cut and paste one.
Yeah.
To have, without over duplication, we can refer from one document to the other. We can refer to our own internal policies. I'm just trying to think of one now, but within the whole disaster recovery and pandemic response policies that have been in place.
Fantastic. It's music to my ears. I've been hanging on a bit about the pandemic planning, so that's really good to hear.
One topic that also came up from Annie's group, which is in the patient flow and triage, was the business planning and opportunities, like moving ahead. What does it look like after March? And again, who knows, roll your dice. But I was saying that it looks very likely, given that everyone's really responded in kind to the telehealth. It's been welcomed and well received from community members, as well as it means that ongoing care can still be delivered. And, you know, we read today that there's been 91% of that's been phone calls. So I dare say these things are here to stay now that they've been sort of, you know, adopted in this disruptive form. Any thoughts to that as well, Riff?
Yeah, look, I think, you know, the opportunities as far as broadening out telehealth opportunities, that's definitely there. And I can certainly speak for myself at the joy of not having to sit in a waiting room, you know, waiting half an hour or perhaps longer for an appointment that's really of a very routine nature, you know, when you're talking about something like a script renewal, of how fabulous it is as a consumer to just be able to continue on with your work and do what your day is needing you to do anyhow. Your GP or your clinic rings you up when the clinician is ready, and you talk and you negotiate what's needed there. And, you know, just that joy of the simplicity and the slickness of that, and now in association with the availability of e-scripting, making that transfer of prescriptions that whole lot easier as well. You know, I would certainly pay for that, and if there was no Medicare rebate available for that, I would say, well, I'm okay with that. But if you're not taking an hour and a half out of my day for something that really ought to only take 5 minutes, that's worth a lot to me. So that's really just a personal reflection, and I'm sure I'm not alone in recognizing the benefit of that kind of process and how nice that is. And I'd love to hear from others too, if you've had sort of similar feedback from your patients about the process of telehealth or the telephone consultation, and going, wow, that was so easy. It was just so good. I don't have to sit in a waiting room with other perhaps unwell people and overhear conversations that probably I shouldn't be privy to, and that whole sort of space of privacy and confidentiality is maintained actually much better by simply having a telephone conversation. All of that was really very very lovely to experience there. So I would really encourage practices to think about what that could look like should the Medicare rebates fall away when all of this is said and done, and we have got a huge budget deficit that we're facing, and it's entirely likely that decisions will be that Medicare can't support telehealth services going forward. How you can still derive benefit from the systems that you are implementing now, and be able to perhaps capture a new market, a different market, and a different way of service delivery. So that's probably my nugget there for business opportunities.
Peter's just put in the box that they've had a lot of resistance from patients, particularly who have got hearing deficits, that they're really wanting, to see their doctor face to face. And, obviously I think that's a really important aspect of it as well. If it's a barrier that they can't hear properly, then you can't obviously give effective care. And, obviously skin conditions, there's going to be things, isn't there, that need that face to face consultation. There's no doubt about it. And I think the area that I see that there's huge potential to really leverage up this telehealth is chronic disease management. If you've got carved out time, particularly where you can start to put on the video and make sure that they've got that readiness there, we can start to do some of that teaching along the lines of, have they been having, face-to-face, video chats with their family members? Have they been doing online banking? They've been, obviously having to think about different ways of functioning during COVID as well. So they have been playing with technology like no others. And I really see that this is a huge area of potential of starting to get, off the phone more and into videos more. And that's going to be a long road. It's not going to be a quick one, but I can see there's a huge opportunity and potential there as well.
Yes, and of course, there are still, of course, those barriers there of
NBN.
of poor NBN service, and they're the real roadblocks in the way. And hoping that now the NBN upgrades may start to address some of those shortcomings. That there are no easy solutions to those challenges. We're a big country and we have a lot of space to cover too, so the challenges are absolutely real. But I agree that especially with that novel service provision, especially through nurses, it would be just so great for the nurses to come up with those solutions and to actually bring the plan and the opportunity to the broader team as well, to say, look, this is what we could do. This is how we could run it. We can start it small, like all quality improvement projects do, roll it out and see what works. It might be a certain cohort of patients for whom it's better suited than others, but start working in that space and start learning from what works well and what needs tweaking, and just keep modifying it until you get to a spot where you're confident about how you can deliver those services. And we know that there is a whole lot of other new technology around that supports the transfer of health literacy information and remote monitoring of patient health conditions, the blood glucose monitoring and the like, and blood pressure and all of that. So I think all of that is absolutely going to start to come together. And again, my message would be that unless we really start investigating what's out there, what could we do, have that curiosity to say what's next and what's possible, someone else is going to take that market away from you if you don't start contemplating what it could look like for your practice and really flip yourself into that leadership space rather than sitting back and waiting for others to take the jump in that. So I guess it's very much about the practice's mindset and the readiness to start to embrace some of that sort of, you know, broad sky thinking, I guess.
So Rick, on that note, that's a nice segue into when we want to be curious and creative, we need to look after ourselves. So the self-care strategies, I'm just going to invite Dee to the stage. Just who would be appointed from your room, Dee?
We've got Vanessa Cornwell. Vanessa's from Ballarat Group
Thanks,
Practice.
Vanessa. Go for it.
Thanks, ladies. We had a few technical issues, so only a couple of us were speaking, others were typing. But when we were looking at self-care strategies, what we were focusing on was probably how to support ourselves and also support staff. And some of the ideas were in regards to having extra breaks, having short walks, or creating a space around the practice for people to take a bit of a break, eating well and staying hydrated. Sonia had actually mentioned about ceasing her social media account, shutting that down, because that, and I found the same thing in the beginning of COVID. It became quite overwhelming with all the information. We also, from my perspective at our work, what we've been doing the last number of months is every week, at the beginning of every week, we send out a uniformed communication to staff regarding links to, you know, how mindfulness and to yoga and to self-help strategies. And we also have been really promoting our EAP for everyone, because a lot of staff and practice managers are trying to deal with, you know, working from home, teaching kids from home, and then, you know, there's some families who have lost income. So the EAP has been really important. The other one was Sonia said at their practice they've got free boxing sessions. Yeah, and then at our practice, we put on a lunch a little while ago. We had the paella van come. We have 3 sites. So the paella van came to each site on a different day and everyone ate outside, social distancing. So I think that's probably all of what we had in our discussion.
All right. Well, I'm furiously typing here because we collated some of that intel prior to you guys registering. And meanwhile, back at the ranch, I've been creating a nice little word cloud for you guys to capture that data. So let's have a look at that. So we've got a nice little word cloud that I'm more than happy to share. You've got so much of a vast variety. And one key theme that really is quite strong throughout all this is a need for positivity. Positivity, not only with your own mindset, but within your teams. So there's loads of different ideas here, supporting each other, eating well, affirming the team, making sure we've got a work-life balance, looking ahead, making sure that we look after each other, so that supportive structure, open communication, celebrating just small things and also birthdays, and making sure that we continue to celebrate a win no matter. So I'm going to share this to the team, PDF it for you, so you guys can no doubt take that, pop it on a wall. So it might even just pepper a few more discussions within your practices as well.
Fantastic. So we've had a really good sort of broad discussion on various aspects of our practice's performance during this space of COVID. And I will hand back over to Katrina Martin to wrap it up. Let me just bring my my screen share back up. There we go.
And Katrina, yes, food does come up a lot, and coffee. And probably I've reduced how many times that actually did come through. Might be on mute.
Yes,
Katrina.
I am. Sorry, because I'm copying and pasting at the same time. I'm just putting the evaluation link into the chat for everyone as well. That will also that'll also come through from Rivka as well in the follow-up email. But yeah, just like to take this opportunity to thank everyone for coming along today, and to thank Kim and Rivka and the West Vic PHN staff as well for coming along and making the session so enjoyable. Yeah, so that's it from us. Thanks a lot. We'd love to hear your feedback in the evaluation, because that helps us to plan our upcoming future sessions as well. So thank you very much, everyone.
Terrific. Thank you.
Thanks, everyone. Have a good day.